Hello everybody. In this lecture we will continue with the subject of an approach to health through human life. The objectives of this lecture is to describe the preventive care services applied in a health maintenance visit in an adult and describe preventive care services applied in a health maintenance visit for elderly. In the beginning, as we said, ill health is a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity. And this is the definition of a WHO. And we classify the life into 5 main stages: infancy, childhood, adolescence, adulthood, and old age. Now, for the health maintenance visit for adults, which are between the age of 20 and 64 years. Individual patient preference is an important consideration here, particularly when a recommendation from various health authorities differ significantly. The clinician and the patient should be engaged in shared decision making on the risk and the benefits of an intervention for that individual. Patients who are more actively involved in their care are found to be more likely to be follow through with health advice and be satisfied with their health care. The source of a recommendation in all these lectures are depending on Iraqi Ministry of Health recommendations, World Health Organization recommendation, U.S. Preventive Health Services Task Force recommendation, and the American Academy of Family Physicians. At first, we will discuss the risk assessment. History and examination is the component of a risk assessment, and they tailor other preventive services. Full knowledge must exist for warning signs such as unexplained weight loss and change in bowel habit, which will indicate the presence of a malignancy, shortness of breath, which may relate to angina or ischemia, and sudden headaches, which may indicate subarachnoid hemorrhage. Special tools have been designed to estimate the predicted primary risk of atherosclerotic cardiovascular disease. And the cardiovascular risk assessment tool may include one of them pooled cohort equations. And this estimates the 10-year primary risk of atherosclerotic cardiovascular disease, example non-fatal MI, coronary heart disease death, or stroke, among patients without pre-existing cardiovascular disease who are between the age of 40 and 79 years of age. And this is a picture of a pooled cohort equation tool. And as we said, it contains information about gender, age, race, cholesterol level, HDL level, systolic blood pressure level, whether a patient receiving treatment or not for high blood pressure, diabetes, and the smoking status. And we will now take an let's suppose certain individual male of age of 50 years, and it is considered to be a white with a total cholesterol level of 175 and HDL cholesterol of 45. This patient have systolic blood pressure of 135 and it is hypertensive, receiving treatment. He has no diabetes, but it is a smoker. So let's see what is the calculated risk. So the calculated risk for this patient is 9.1%. To have a 10-year risk of atherosclerotic cardiovascular disease, while comparable risk for optimal risk factor patient is 2.1%. Now we will talk about the screening for an adult patient. individual. For the obesity, body mass index should be calculated at every visit. Hypertension by measuring blood pressure for every individual with age of 20 years or older every 2 to 3 years. For lipid disorder, lipid screening in adults with no symptoms or history of cardiovascular disease who age 40 to 75 years should be conducted every 5 years. And for diabetes in Iraq, all adults equal or more than 40 years of age should perform measuring of blood sugar every 3 years. And those with additional risk factor should perform the test at younger age. For depression, recommended screening for depression when there is staff-assisted depression care support are available. For tobacco use, ask about tobacco use and provide counseling as appropriate. For the cervical cancer, pap smear is advised to be conducted in Iraq for married women between the age of 21 and 65 years every 3 years. For the breast cancer, assessment should be first for risk status, whether this woman is average risk or high risk woman. Risk factors include family history of breast cancer, personal history of pre-malignant or malignant breast lesions, certain mutation in Berq1 and Berq2 genes, dense breast tissue, and exposure to radiation during early years of life, especially in the chest region. And this table shows the schedule of screening of breast cancer in average risk women. While for the high risk women, the risk will be assessed individually according to each state, test or condition. And this picture shows how to do the mammogram. And here is the result of a mammogram. And in the left we will see a picture of a normal mammogram, and in the middle we see a picture of benign cyst without cancer, and in the right there is a picture of a cancerous lesion or suspected cancerous lesion. But please do that most of the leading international healthcare authorities recommend currently the use of a mammogram alone for early detection of breast cancer in average risk women. However, in Iraq, we will continue to do the breast self-examination and the clinical breast examination, and in addition to the mammogram. They have replaced the breast self-examination and the clinical breast examination with breast self-awareness, and the patient being familiar with how her breasts look and feel, which can help to notice symptoms such as lumps, pain, or change in size that may be of concern. Other screening issue is a colorectal cancer screening, and this screening should be conducted for adults between the age of 50 and 75 years. And the methods used for screening are annual fecal occult blood testing, and if positive, the patient should conduct colonoscopy, or fecal occult blood testing every 3 years plus flexible sigmoidoscopy every 5 years, or colonoscopy every 10 years, which is widely recommended. For lung cancer, annual screening with low-dose computed tomography is recommended. But for who should be screened? Those adult age 50 to 80 years of age and have a history of heavy smoking, 30 packs a year, and currently smoke or have quit smoking within the past 15 years. For the immunization, hepatitis B vaccine should be given in 3 doses for those who are not previously immunized and have high risk of acquiring disease. For tetanus toxoid, 5 doses for pregnant women and those at childbearing age. Under influenza, Vaccine, it is essentially recommended for those with chronic health conditions such as diabetes, hypertension, asthma, and etc. Other vaccine may include pneumococcus vaccine for person with chronic disease and meningococcus vaccine for a splenic patient. For chemoprophylaxis, aspirin in low dose is recommended for primary prevention of cardiovascular disease and colorectal cancer. But the question is, who should be advised to initiate aspirin? The answer is those who meet all of the following criteria. 1. Age between 50 and 59 years. 2. Calculated 10 years risk of a cardiovascular event is equal or more than 10% and not at increased risk for bleeding, and have a life expectancy of at least 10 years, and willing to take aspirin daily for at least 10 years. Adults with age 60 to 69 years should decide with their primary care clinician if aspirin use for primary prevention is right for them. Adult aged 70 years or older and those with 50 years, younger than 50 years have no sufficient evidence to assess the balance of the benefits and the harm of initiating aspirin use for the primary prevention. For lipid-lowering agent or statin with low to moderate dose, those who meet all of the following criteria can take them. Age between 40 and 75 years, have one or more cardiovascular disease risk factors such as dyslipidemia, diabetes, hypertension, or smoking, and the calculated 10-year risk of a cardiovascular events is equal or more than 10%. What about chemoprophylaxis during pregnancy? And this included folate at a dose of 0.4 mg per day to prevent neural tube defects, and iron in a dose of 30 to 60 mg per day to prevent maternal anemia, puerperal sepsis, low birth weight, and preterm birth. For counseling in adults, it should include advice about diet, such as nutritional assessment for fat, cholesterol, complex carbohydrate, fiber, sodium, and iron and calcium. Calcium is especially important for women in a dose of 1,000 to 1,200 mg per day. Adverse effect of carbonated drinks with phosphorus on calcium and bone growth should be discussed. And the vitamin, especially antioxidant A, C, and E, and the mineral supplementation should be discussed. For exercise, regular exercise at moderate intensity for 150 minutes per week or vigorous intensity at 75 minutes per week. In addition to muscle strengthening activities at least twice a week. Substance use. Advice on smoking cessation, limiting alcohol consumption, and the health effects of other drugs. Advice on not driving or doing other dangerous activities while under the influence of intoxicants. Injury prevention. Use of safety belt advice is given in motor vehicles and helmets on motorcycle and bicycles. Prevention of violent behavior. Safe use and storage of firearms. Use of smoking and carbon monoxide detectors. And for dental health, to ensure good personal oral hygiene. Daily brushing and flossing and the use of fluoride, and the avoidance of sugary foods, with periodic visit to the dentist. For premarital counseling, it can reduce the risk of hereditary disease such as hemoglobinopathy, congenital malformations, sexual transmitted disease, and others. promote awareness regarding reproductive health, family planning, and healthy lifestyle, and for preconception counseling, health promotion activities, of folate supplements, healthy weight, abstinence from alcohol, drugs, and tobacco products, and lowering risk of sexually transmitted disease, and the control of chronic disease and the recognition of their medication for teratogenic effects, such as for medication of hypertension, diabetes, seizures, hypothyroidism, acne, and asthma. And now we will talk on the health maintenance visits for all age individual and the elderly who age 65 years and more. Family physicians are responsible for the care of an increasing number of elderly and their special needs. This requires a change in the definition of health and well-being, as 80% of elderly have at least one chronic condition, and 50% of them have at least two chronic conditions. First, as usual, we will talk on a risk assessment. Geriatric risk assessment should include review of medical records with focus on risk factors for geriatric syndromes, medication histories past and present, nutritional evaluation, with knowledge of alarming signs and the calculation of 10 years cardiovascular disease risk. Functional assessment for impairment in mobility increase the risk of falls, depression, institutionalization, and death. History of functional status and the activities of daily living. Example, bathing, toileting, grooming, and meal preparation. Balance assessment and the measurement of gait speed. Example, timed up and go test. And this is a picture show how we can do the timed up and walk test. It should be conducted in 10 seconds. And this another picture. Risk assessment also include assessment of the special sense, and the visual and hearing loss contribute to functional decline and cognitive impairment. Vision can be assessed by using a Snellen chart, and the hearing by history or whisper test. For cognitive impairment, to detect dementia, mental state examination tools and cognitive assessment procedure can be used, such as Montreal Cognitive Assessment Tool. And this is a picture for Montreal Cognitive Assessment Tool. And this is another picture for the tool that is represent the Arabic version of the tool. Also, in a risk assessment, we assess for polypharmacy, and the use of multiple medication is a common problem in the elderly. And the actions that should be taken is extensive review of prescription and over-the-counter drugs, vitamins, and herbal products to simplify drug regime. And the benefits of this action is improved compliance, decrease the incidence of adverse drug reactions, and save money. For screening, weight status, whether the individual is underweight or overweight or obese, and for depression by the use of depression screening instruments, for the hypertension by measuring blood pressure every year, for osteoporosis in the women by the use of DEXA for the women aged 65 years or older, abdominal aortic aneurysm by the use of ultrasound for abdominal aorta for smoker men between the age of 65 and 75 years at least once. For hypothyroidism, no routine screening is indicated, but a low threshold for ordering thyroid function tests should be maintained. by the use of thyroid stimulating hormone or T4. Other screening tools such as for dyslipidemia, diabetes mellitus, breast cancer, and colonic cancer as in the adult individual. For immunization, influenza vaccine is recommended for elderly who are consent to take it and not have a previous severe allergic reaction, and should be given every year between starting in October or November. And the benefit of this vaccine is decreasing incidence of influenza and pneumonia, and decreasing hospitalization for this disease, and may reduce the risk of cardiovascular disease. Other vaccines include the herpes zoster vaccine once for those more than 60 years, pneumococcal vaccine once for those more than 65 years, and tetanus, diphtheria, and pertussis once for those more than 65 years. For the chemoprophylaxis, aspirin and statin as discussed in the adult recommendation, and in multivitamins don't recommend it for routine use. For the counseling for diet, general dietary recommendation as that in the adults, and ensure vitamin D and calcium sufficiency to decrease the risk of ill falls, and increase dietary fiber to prevent constipation. Prevention of ill falls and ill injuries by counseling regarding the dangers of ill falls and avoidable causes, and these can be classified into extrinsic factors such as poor lighting and throw drugs, and intrinsic factors such as visual deficiencies, medications, and debilitation. For exercise, the required amount and the types of exercise are the same as those of adults, and gradually increasing exercise capacity by walking, gardening, or doing household chores. Benefits include lower incidence of falls, cardiovascular disease, dementia, osteoporosis, and improved mood. Smoking cessation should be also advised, and the benefit is achieved from stop smoking at any age. Routine dental care by daily brushing, flossing, and periodic visit to the dentist. And thank you for all.